Milton J. Rosenau supervised this landmark study titled Experiments to Determine Mode of Spread of Influenza, which was published in the Journal of the American Medical Association in 1919. The experiments were conducted at Gallops Island, the quarantine station in Boston Harbor. Quoting directly from the study, the experiment began with 100 volunteers from the Navy who had no history of influenza. Rosenau was the first to report on the experiments conducted at Gallops Island in November and December 1918. His first volunteers received first one strain and then several strains of Pfeiffer's bacillus by spray and swab into their noses and throats and then into their eyes. When that procedure failed to produce disease, others were inoculated with mixtures of other organisms isolated from the throats and noses of influenza patients. Next, some volunteers received injections of blood from influenza patients. Finally, 13 of the volunteers were taken into an influenza ward and exposed to 10 influenza patients each. Each volunteer was to shake hands with each patient, to talk with him at close range, and to permit him to cough directly into his face. None of the volunteers in these experiments developed influenza. Rosenau was clearly puzzled, and he cautioned against drawing conclusions from negative results. In the JAMA article, Rosenau concluded, "As a matter of fact, we entered the outbreak with a notion that we knew the cause of the disease, and were quite sure we knew how it was transmitted from person to person. Perhaps if we have learned anything, it is that we are not quite sure what we know about the disease." A companion study done at the same time at Angel Island in San Francisco produced similar negative results. Both studies concluded that what was considered to be one of the most contagious of communicable diseases in history could not be transferred under experimental conditions. As well as challenging the contagion orthodoxy, the results of the Rosenau experiments repudiate yet another pillar of the Spanish flu mythos.